Good afternoon, class. So now we're going to talk about sick call, how to collect your patient, how to walk the patient through a sick call procedure, how to talk to and interact with your provider so that this patient can be seen in an efficient, timely manner and taken care of also. So we'll start with collecting the patient. You will enter the waiting area. You will check the record that you have for your patient's name. That will be your first identifier. So my patient is Chief Robinson. Do I have a Chief Robinson? Now that you have your patient, you're going to say, okay, Chief Robinson, can you please follow me this way? During this time, you want to engage your patient in some type of polite conversation so that your patient feels comfortable. Chief, how are you doing today? That's great. Glad to hear that. When you bring your patient to the operatory, you should remove all obstacles out of your patient's way so that they do not have any hazards of tripping or falling or bumping into sharps. Chief, you can go ahead and have a seat. When your patient goes to have a seat, the arms should be out of their way. Remember, this is locked, this is unlocked. Please unlock the armrest so the patient can get into the chair safely. Now that your patient is seated, you want to first go through a couple of identifiers for your patient. So now that we have the patient in an operatory and they are away from everyone, you can say, can you please let me know your full name and your date of birth? This patient will then give their full name, their date of birth. You will verify with your record that that information is correct. If it is, then you know you have the right patient and you have the right record. Now, when going through sick call, the number one thing is to verify that your patient is there for what you think they're there for and to go over their health questionnaire with them. The health questionnaire is going to show you the history of this patient as well as if there are any contraindications to treatment. Chief Robinson, it looks like that you have not filled out your health questionnaire. So we're going to have you fill that out very quickly, okay? At this time, if you see that your patient has not filled out their health questionnaire, you're going to give them their record along with a pen to fill that out. Let's say this patient had completed their health questionnaire and it showed that they have been taking medication or that they have allergies. Chief Robinson, I see here that you have been taking some high blood pressure medication. Are you currently still taking that medication? If the patient says yes, you want to confirm the name of the medication and if they have taken that medication today. If the patient says no, then you will have that patient one-line that information and initial it and correct it. This is to make sure that your health questionnaire is up to date at all times. You're then going to verify that this patient does not have any allergies. Chief Robinson, do you currently have any allergies or have you known to have any allergies to latex? No. Then you can move on. If yes, verify that what you have is correct and then continue on. Another thing after checking the health questionnaire, you want to take this patient's blood pressure. Blood pressure, temperature is a very important step in sick call procedures because if a patient is there for sick call, then they may have some other things going on, such as an infection, which will cause a fever in a patient. If the patient has uncontrolled high blood pressure, this is a point in your appointment where you will find if this patient's blood pressure is very high and they may need a referral to medical. Once you have gathered all that information and you are ready for your patient to be seen by the provider, you're going to confirm what they are here for. Chief Robinson, from my understanding, you're here today for sick call because you have a crack in one of your fillings. At this time, your patient is going to confirm that that is what they're there for, or they're going to deny and tell you what they're actually there for. Let's say that patient is here for sick call for that. They're experiencing some pain and sensitivity due to a crack in their filling. Now, at this point, we're going to stop for a moment and we're going to observe the scene that we have this patient in. The patient is seated. They have on their goggles. They have on their patient napkin. That is their PPE. We have went over setup for our operatories, but specifically for sick call, we want a BDS or an exam pack available for the provider to examine this patient. Included in that BDS setup is going to be your perio probe, your explorer, your cotton forceps, your mirror, and your provider's gloves, mask, and eyewear. Once you have your setup complete, your patient seated, you've went over the forms, and you've verified with the patient that what they are here for, you are now ready to go and brief your provider. Never forget to take your record with you. Sir or ma'am, we have a patient by the name of Chief Robinson who is here for sick call today. They are experiencing some sensitivity and pain on a cracked filling. Would you like for me to take x-rays on that area? At this time, your provider will order x-rays for that patient. If x-rays are needed, you will take the patient to the x-ray area and you will ask them to remove any removable items or jewelry, to include oral jewelry, removable partial dentures, removable retainers, anything that can come out of the patient's mouth, to include necklaces and earrings that may be on the patient, they will take off at that time. If you have a female patient, you will always ask whether or not that patient may be pregnant. This is very important. Also, you have to remember to place the PPE on the patient in the x-ray room, which is the lead vest. After you take x-rays on this patient, you bring them back, you seat them, and you lock the patient in. Once the patient is locked in, you're going to go to your computer, bring up the x-rays you have taken, and have them ready for the provider to view once they come into the operatory. Sir, Chief Robinson is available and ready for you to see. Your provider at this time will enter the room. Hand hygiene. Place on your PPE. This time you want your gloves to kind of be on a standby because your provider has to do an examination and treatment plan what's wrong with this patient. So you will be responsible for writing down anything that is found on your oral exam form. You do not hold your record or write into the record with your gloves on. You will document these items without gloves until the provider decides whether or not they will treat the patient. Once the provider is ready to treat the patient, you will place full PPE on to include your gloves, and you will place yourself into your assisting chair to assist your provider. After watching this video, please refer to your sick call procedure section as well as your sick call procedure progress check for any questions that you may have. Thank you.